Welcome to Deep Dive. Today, we're getting into something a bit different in feline health, a parasitic infection called Ollulanus.
Yeah, it's definitely not one you hear about every day.
Right, so forget the usual stuff for a minute. We're diving into this tiny worm and its, well, surprisingly complex life.
Exactly. We've been looking at this medical text excerpt, Feline Ollulanus infection, diagnosis and treatment, and it really paints a fascinating picture.
So the mission today.
Well, we want to really get a handle on what this infection actually is, how it affects cats, and honestly, why it's more interesting than it sounds. We're going for those aha moments for you listening.
Okay, let's start unpacking it. This Ollulanus infection, it's caused by a really tiny parasitic worm, right? A type of roundworm.
A trichostrongyloid nematode, technically, and it lives right in the stomach wall of cats.
So these adult worms, they're super small, like under a millimeter, and they coil up right in the stomach lining.
That's right. And the main effect of them being there is chronic gastritis, basically ongoing irritation of the stomach.
Which I imagine leads to some pretty obvious problems for the cat.
Yeah, things like not wanting to eat, anorexia, vomiting, and, well, losing weight because of all that.
Okay, now this is interesting, the life cycle. You mentioned it's kind of self-contained.
It really is. Unlike lots of parasites, these guys don't need to leave the cat to complete their cycle. The females have eggs, they hatch into larvae inside her, and those larvae can grow into adults, all within the stomach.
Wow, so like a little ecosystem just going on in there.
Pretty much, it really affects how the infection persists.
And how does it actually spread from cat to cat then?
Well, this is the slightly less pleasant part. It's mainly through vomit.
Oh, okay.
Yeah, when an infected cat vomits, it can expel these larvae, and if another cat comes into contact with that, well, that's how it spreads.
Right. That makes sense, especially for certain groups of cats.
Exactly. Which brings us to who's most at risk. The text points strongly towards colony cats.
Because they're living so close together.
Precisely.
Yeah.
Much higher chance of encountering infected vomit in that kind of shared space.
And stray cats, too, particularly in cities.
Yeah, same logic, really. Densely populated urban areas mean more cats, more potential contact.
But here's the bit that surprised me. It's not just domestic cats.
No, it mentions captive exotic cats, too. Like cheetahs, lions, tigers, even cougars can get it.
That's wild. Such a tiny worm affecting these huge predators.
It really shows how adaptable parasites can be, doesn't it? They find a way.
So back to what you might actually see in your cat. The main signs are chronic vomiting, right? Not just once or twice.
Correct. Chronic vomiting, that lack of appetite we mentioned, and noticeable weight loss over time. Those are the big three.
And it can get serious.
Oh, definitely. If it's severe or goes untreated, this chronic gastritis can actually be fatal. So, tiny worm, potentially big impact.
Let's dig into the how a bit more. What are these worms physically doing in the stomach?
So the adult worms, Ollulanus tricuspis, they coil themselves into the gastric mucosa, that stomach lining. And just by doing that, they cause these little surface erosions, like tiny scrapes.
Okay, and over time?
Over time, that constant irritation leads to bigger problems. The text describes, significant erosions, a lot of inflammation.
The body trying to fight it.
Exactly. You get these collections of immune cells, lymphoid aggregates, trying to deal with the parasites, and eventually even fibrous changes like scarring in the deeper layers of the stomach wall.
So it's a whole cascade of damage.
It is, all starting from those little worms coiling up.
Yeah.
And that microscopic damage leads to the very real sickness the cat experiences.
And that life cycle, again, eggs hatch inside the female, larvae develop to the infective stage, the L3 stage, right there in the stomach.
Yep. So the cat can just keep reinfecting itself, essentially, or at least maintaining the infection without any external phase needed until, well, vomiting occurs.
And it's mainly those L3 larvae in the vomit that spread it.
Primarily, yes. Though the text does say even adult worms that get vomited up could potentially infect another cat, too. It covers its bases.
Is this found everywhere, or is it specific to certain regions?
It seems pretty widespread, actually. North America, Australia, New Zealand, Europe, Argentina, Chile. It pops up in a lot of places.
So it's quite adaptable, despite the slightly unusual transmission.
It really seems to be. And get this, in Germany, one study suggested up to 40% of free-roaming cats might be infected.
40%. Wow.
Yeah. So definitely not some super rare, obscure thing everywhere. It can be quite common in certain populations.
Okay, so if it can be that common, how do vets actually diagnose it? You mentioned it's tricky.
It is tricky. One key reason is that you rarely find the larvae or eggs in the cat's feces.
Why is that?
Well, the thinking is, if any larvae or eggs do pass out of the stomach into the intestines, they just get digested.
Ah, okay. So a standard fecal test, which vets do all the time, would likely miss it.
Very likely, yes. So
Right.
a negative fecal doesn't rule it out if the cat has those chronic vomiting symptoms.
So the key is the vomit itself.
Exactly. Examining the vomitus is crucial. The text mentions using the Behrman technique specifically to look for those L3 larvae.
The Behrman technique. What does that involve?
It's a method to isolate nematode larvae from a sample. You basically suspend the vomit sample, often in gauze, over water in a special funnel. The live larvae will actively move out of the sample down into the water.
Clever.
Yeah, then you can collect the water at the bottom and check it under a microscope. Seeing those L3 larvae is pretty diagnostic.
The text even says vets might induce vomiting with xylazine.
It does mention that,
Yeah.
with about a 70% success rate for getting a sample that way. Shows how important examining vomit is for this one.
What about things like ultrasound?
Ultrasound might show some general thickening of the stomach wall because of the inflammation, but you're very unlikely to actually see the worms themselves. They're just too small.
And more invasive stuff, like endoscopy.
Endoscopy is an option, putting a camera down into the stomach.
Mm-hmm.
But again, the worms are tiny, so spotting them directly is difficult. Other options are gastric lavage, basically washing out the stomach with saline and then examining that fluid, maybe using the Behrman on it too, or taking biopsies of the stomach lining for histopathology.
Looking at the tissue under a microscope.
Right.
Yeah.
You might see the parasites in the tissue sections sometimes, but it's not guaranteed.
So the takeaway for owners is diagnosis isn't simple. It requires specific approaches focused on the vomit or stomach contents.
Definitely. And it's also really important to remember how many other things cause vomiting in cats. The text lists loads of possibilities: diet, toxins, metabolic issues, other gut problems, even heart disease or neurological issues.
Right. So it's a process of elimination, too.
Absolutely. A vet needs to do a thorough workup.
Okay, let's talk treatment. If Ollulanus is diagnosed, what can be done? The text sounded like options are a bit limited.
That seems to be the case, yeah. There aren't tons of well-documented, highly effective treatments readily available everywhere.
It mentioned tetramethyl.
Yes, tetramethyl, given as a 2.5% formulation orally, just once, seems effective according to the source. But, and this is big, but for many listeners, that specific formulation isn't available in the United States.
Okay, that's crucial info. So if you're in the U.S., that option's out. What else?
Well, the text lists a few others that have been recommended: Fenbendazole, oxybenzole, and pyrantel palmate. These are common dewormers for other things.
Right.
But there's a caveat. The text notes there's limited data on how successful they actually are specifically against Ollulanus.
So less certainty there.
Right. And the follow-up advice is important too.
Which is?
Owners need to watch closely for any more vomiting after treatment. If the tetramethyl was used, were available, and wasn't fully effective, another dose might be needed. The good news is side effects at the suggested dose aren't expected.
Okay, so let's wrap this up. Key takeaways from our deep dive. Ollulanus is this persistent stomach worm in cats, spread mostly through vomit.
Affects various cats, even big wild ones, globally. Diagnosis hinges on looking at vomit, not feces usually.
And treatment options are a bit restricted, especially in the U.S. That self-contained life cycle is really part of what makes it so persistent, isn't it?
Absolutely. And I think the really interesting bits are how it hides from normal fecal tests, how even huge cats can get it, and just how common it can be in places like Germany. It really complicates the picture of feline parasites.
Yeah, it's that hidden nature that's quite something.
It's a classic parasite trick, really finding ways to persist and spread that aren't immediately obvious.
So this leaves us with a final thought for you, the listener. Given that this causes chronic illness and spreads through something as common as vomiting, what does this tell us about managing parasites in general, especially where animals live close together, like shuckers or colonies?
It definitely makes you think about the connections, doesn't it? Between animal health, their behaviors, and these tiny organisms that often go unseen.
Right. Kind of unsettling that such a small creature can cause significant issues through such a common feline behavior. Something to ponder.